Hi, it's Dr. Daly. You may have heard about the current medication crisis that we have. In particular, many agencies are short of D50, and it's on national back order. Likely will not be repleted by the end of the summer. Some agencies have more in stock than others, and as a result, when we do an emergency substitution at some agencies, we'll be able to study that emergency substitution. If you're watching this video, it's because your agency has enough of a supply of D50 to at the very least get through part of the summer. As such, we're asking you to help us out. We need to be sure that the D10 that we're substituting has the same efficacy of treating hypoglycemic adults as the D50 that we had previously used. The total amount of dextrose will be the same at 25 grams. However, we may be in a position where we're using less dextrose, so only part of a bag of D10, or we may find that we need more because it's less concentrated. We may also find that we have complications because of increased fluid volume. There are many questions about making a change like this that we don't know the answer to. So we're asking, as you do the standard therapy, which is an amp of D50 to treat a hypoglycemic adult, you complete a brief data sheet. The data sheet itself is a quality assurance equivalency review, and it has no patient identifying information on it. It also has no provider identifying information on it. It's very important to collect these data sheets and to do them accurately so that we have a good picture of exactly how EMS is treating hypoglycemic adults and how well the D50 is working. That way we can compare it to the D10. The initial patient information we're going to record is just going to be simple age and gender, their Glasgow Coma scale, but please break it down into its three elements. Initial blood glucose, time the patient was last seen normal so we have an idea of how long they were hypoglycemic, and the time of patient contact. Then you're going to give the D50. Please record the time of the bolus and check the IV site the same way you always do to make sure that there isn't a complication. If there is a complication, please make a note of it on the bottom of the document and what that complication was. After the patient has begun to come back to a normal level of consciousness, record the initial time of arousal, the time the patient regains their baseline, or a Glasgow Coma score of 15, whichever is appropriate for the patient. Please perform a repeat blood glucose and record that time as well. We'd like to know if these patients refuse transport, and we know many of them do. We'd also like to know if the patient has prior history of hypoglycemia, because we do know that some of these patients have frequent episodes of hypoglycemia. We'd like to know if we have more patients on insulin pumps or more patients on one medication than another on one of our treatment arms. However, we do also recognize that some patients won't know the name of their injections, won't know the name of their oral medications. If they don't know, please just check on known injection or unknown oral medication. There'll be other changes as well this summer. Hopefully most of them will be easy. We're going to work as hard as we can to make sure that we've got answers to the questions you're asking, like why are we running out of these medications? In the meantime, thank you very much for helping us out with this. It means a lot to our patients. We need to make sure we're taking care of them as well as possible. Thank you.